Hello out there in television land. Welcome to yet another edition of It's Your Health, where we bring you the latest in healthcare information. I'm with my bride. Do you have anything to say about our adoring viewers?
Adoring?
That's what I'm told.
I think that they're wonderful just to watch
You're
or
right.
listen.
Just like me. We'll be right back.
I didn't say that.
After this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information, and make sure you check with your healthcare provider before doing the things that we talk about here on It's Your Health. We'll be right back.
Welcome back, and there you see us getting ready for dinner. You know, on the last show we talked about how to be careful when you're making things in the microwave and other things. But if you come and have dinner with us, you'll be sitting right across the table from the three of us.
Absolutely, and the one in the middle kind of runs the show, huh?
Yes, absolutely.
Well, you want to start us off, sweetheart?
Oh, I guess I'm a little tired today.
Is that right?
Yes, well, I should have some melatonin maybe.
Oh.
Oh, it's a hormone naturally produced by your body, and it's associated with your sleep cycle. Your body's melatonin levels increase as darkness approaches, peak during the night, and decrease in the morning.
Well, so they've made a supplement that has melatonin over the counter. And I'm telling you, I think I see sleep disorders and complaints almost more than anything else. And people just strive and crave a good night's sleep. And some people go to sleep watching the news, which might explain their insomnia. But melatonin's a great drug to try. It's over the counter, low incidence of side effects. So you may want to give it a try.
Side effects, daytime sleepiness and tiredness and fatigue are some symptoms, so you might want to start with at a low dose.
Go low and go slow.
Absolutely. Metformin versus lifestyle changes for the prevention of type 2 diabetes. It's more effective than standard lifestyle changes. Intensive lifestyle interventions are as effective as medicine.
Well, we'd like to consider a no-drug approach therapy. We're talking about pre-diabetics, and that's, of course, diagnosed by what's called the hemoglobin A1C, which is the average blood sugar over a 3-month period of time. Usually, we'd like to see you in the 5 range, but if you're approaching 6, then you're pre-diabetic, and some patients would require metformin, but we'd like to stay away from the medications. Do the lifestyle changes which got you there to begin with, and chances are you're going to correct the pre-diabetic problem.
And you have to consider what's the hardest thing to do. It's much easier to take a pill than to follow the changes in your lifestyle.
Yeah, diet and weight loss, they're tough prescriptions.
Next headline, another one which of course I can't read. Chlorthalidone.
Chlorthalidone?
Yeah, that's it. For hypertension in advanced chronic kidney disease.
Right, from the New England Journal of Medicine. People who have chronic kidney disease often have uncontrolled hypertension, which will make the kidney disease worse. And in the old days, we thought about thiazide diuretics, which this is, and we were concerned it would make the kidney disease worse. In point of fact, what happens is it doesn't do that as much as we thought, but it controls the blood pressure a great deal because it releases excess fluid and sodium in your system. So that's one of those oldies but goodies type of drugs. And you know, speaking of hypertension, that is such a silent killer out there. Now, you'd never have a year go by when you didn't check the tire pressure in your car, because the tire pressure, if it's off, will cause the tires to wear out prematurely. Our arteries are no different. And hypertension is one of those silent killers out there. and you should get your blood pressure checked. It's one of the leading undiagnosed and therefore untreated issues, which can lead to stroke and heart attack, premature aging of the arteries.
How easy is it to treat?
Very easy. I cannot imagine anyone out there with uncontrolled hypertension, and it's very easily treated. And of course, we'll provide you your biggest IRA or 401k for the future. That's your best bet. And keep in mind 130 over 80 or less is where you'd probably want to be. But again, it's individualized by other issues as well.
Very well said, doctor. Thank you so much.
Can I go home now?
No, but you look like a doctor with your blue coat on today.
Well, you know, people come in and they say, I have white coat hypertension, but they can't because I'm wearing a blue coat. So.
I have white coat hypertension.
All right.
I'm married to him.
That's all right.
Okay, the science of sunburns. They're coming up. Why they happen and how to treat them.
Well, it's UV light, and UV light can
I
even
had
happen.
some things to say here, you know.
Oh, really? Well,
Yeah.
let me sit back and take a spell here. Go ahead.
Mostly between 10 a.m. and 4 p.m. you should not be outside, and especially in the summer months. You should have to be careful of blistering sunburn. It doubles the risk of developing melanoma. Okay, it's all yours.
Okay, well, there are benefits to sunlight, otherwise we wouldn't have it. It improves your mood. It makes vitamin D, and but too much of a good thing is no good either. And unfortunately, tanning is almost equivalent to getting a sunburn because it prematurely ages the skin and can lead to skin cancers. So I hate to hit the tanning bed industry, but it's something that probably should be avoided.
And there's different kinds of skin cancers also to be considered.
Right. There's the superficial, what we call squamous cell skin cancers. There's basal ones, which are deeper, and those require a little bit more excision. And of course, there's melanoma, which can be deadly, of course. And that leads us to say, perhaps just like getting your car checked, the skin is the largest organ in our body, and it's easily examined. And so maybe you should put on your to-do list getting a skin cancer examination by a dermatologist. Do that once a year.
What is skin cancer screening?
Well, you go into the dermatologist and you get undressed, wear a paper gown, of course, and they will look at all of your areas and see if there's moles that are suspicious or pre-cancerous lesions that need to be frozen or taken care of. Mm-hmm. So those are things that you would want to get on a regular basis. The average family physician is not going to get you undressed and do a total skin exam. And he may see some things anyway that says, look, you got to see the dermatologist. So I would just see the dermatologist and get an annual skin cancer test.
Do we have dermatologists in the Hazleton area?
We have excellent dermatologists. Some of them are on Samsung Productions.
Oh, wow. Okay. How can you reduce your risk of skin cancer? Wearing sunscreen and reapplying it, wearing wide-brimmed hats and long-sleeve pants, especially during the daylight hours, and avoid tanning beds.
Yeah, you ought to do that. And one of the interesting things is that with the use of sunscreens, we've seen more of an incidence of vitamin D deficiency because the ultraviolet lights are not making vitamin D. I'm out of breath. I need a break. And so do you out there in television land. We'll be right back after this brief commercial message. You're watching It's Your Health.
Well, you know, I might have had some recent surgery, but none of my anesthesiologists were standing over me holding our rock.
It's out of the Flintstone era, correct?
Thank goodness we've come such a long way.
No doubt.
All right, we're continuing with our talk of cancer. We're going to talk about multiple myeloma. It's a cancer of plasma cells, and it blocks the production of healthy cells. It causes anemia, fatigue, painful lesions.
Right. Well, it's a disorder of the bone marrow, and you end up making more plasma cells, which is a segment of your white cells. So it can also lead to infections, high calcium levels, renal disease. Unfortunately, it's not curable, but it is treatable. And so it's part of getting a regular exam and a CBC and what's called a chem profile. Sometimes that can be a screening test to do further tests to make sure you don't have multiple myeloma.
Now, which one should I be getting? The screening, the skin screening, or some?
This is part of a general physical exam, an annual exam.
Oh, okay. So when I go for my Medicare exam.
Correct, yeah. Are you old enough for Medicare?
Barely.
I figured as much.
Next one, screening for atrial fibrillation is the most common type of irregular heartbeat in adults. It occurs in men more than women. 10% of people 50 and older have it. And many people with atrial fibrillation are asymptomatic, which means they don't know they have it, and that's bad.
Right, you can listen to the heart, that's why we do that, to see if it's irregular. You can get an electrocardiogram. And the main issue is that atrial fibrillation can give you a higher risk of stroke and heart attack, so you may need to be on blood thinners. Sometimes associated with alcohol, we call these holiday hearts, where the heart rate may go irregular after using alcohol. But again, part of a physical examination, we listen to your heart. And people with hypertension or palpitations or other chronic illnesses should get an electrocardiogram as, again, part of their annual physical to screen for such things.
I don't think I do that annually.
You must have had a cardiogram somewhere in your life.
I think from you.
Yeah, probably from me. Yeah.
Yeah, you probably said, take off all your clothes and I will give you a cardiogram.
Yeah, not a bad idea.
Let's change the subject.
All righty.
Okay. What is, here we go, polycystic ovary syndrome? It affects individuals throughout the world, between 6 and 10% of people, and it includes being overweight, obese, high blood pressure, adult onset diabetes, glucose intolerance, and I could name more.
It's a hormone imbalance, obviously seen in females who have a little bit too much male hormone, and sometimes they'll have some male pattern baldness and maybe have some facial hair. Can lead to infertility, if you will. And so there are treatment options for this. It's not an uncommon illness that we see. So I would just follow up with your gynecologist to make sure you don't have anything along those lines.
A gynecologist, huh?
Yeah, that I didn't do.
Oh, no, that you didn't do.
Okay.
Okay, we have a whole thing on 6 most common health concerns of women.
All right, let's get through these.
Go ahead.
Cardiovascular health is one of the biggest because heart disease is very common in women, has sometimes atypical symptoms. That is, they may not get the chest pain going down the left arm. They may feel lightheaded, dizzy.
You may get neck pain.
Yes. So it's just not exactly something that you'd suspect, which is sometimes why it's misdiagnosed or not diagnosed till a later date. But cardiovascular disease in women needs to be looked at.
Okay, go ahead.
Moving right along. The other issue is metabolic syndrome. We see this in people who have weight issues and can lead to high blood pressure, high blood sugar, mood disorders, infertility issues, irregular periods, metabolic syndrome. Third thing is fertility issues. Of course, we worry about this in women who are trying to have families. Again, following up with your gynecologist is important. Mental health issues. Big problem that we see. And you would claim maybe the husbands are to blame, but nevertheless, life in general, going through life disorders, we spend a lot of time on hypertension, diabetes, screening for this.
Osteoporosis.
Right, and we unfortunately forget about mental health, and that's very, very important. Breast disease, breast cancer, #1 cancer in women. We can examine breasts, we can get mammograms, we can get ultrasounds. You need to keep up with that type of thing. And the biggest risk factor for breast cancer is family and age, because as we get older, the risk doesn't change. So you would think it would. And of course, autoimmune disorders. We don't think about this a great deal, but fibromyalgia, lupus, arthritis, we see these things particularly flared after menopause.
But aren't a lot of those genetic?
Correct.
Like the lupus and stuff?
Right. Well, I've always said you got to pick good parents.
We did pretty good.
All right. Well,
I give these to you because I know you wanted those.
I thank you.
Okay. Next headline. When sex hurts. Pain should not interfere with pleasure. Painful sex is a problem many shove under the covers. Discomfort during intercourse is exceedingly common, more than you'd think. 3/4 of women experience it at some point in their lives. Up to 6 in 10 women report painful sex as they reach menopause. And we all who have been there know how menopause messes everything up.
Well, again, keeping up with your gynecology exam, it's something that we don't hear a great deal because a lot of people don't want to necessarily talk about it. So if we don't hear about it, we can't really try to fix it.
It's hard. It's something that's hard to talk about.
Well, sure, and guys have the same problem. You know, we see guys all the time who come in for their physical, and before they go out the door, they say, you know what, I'm having some issues in the bedroom, and it's sort of the last...
They kind of didn't want to tell you that, did they?
Until the last minute, but again, something we need to look at a little closer. And so we're moving right along, and unfortunately the second segment is long gone. And
already?
Make sure you call our sponsors and please tell them you heard it on It's Your Health, and better yet, utilize their services because we really appreciate it. We wouldn't be here without your sponsors out there in television.
Don't give them ideas.
Okay. We'll be right back after this brief commercial message. Remember, it's Your Health.
How do you like this one?
It's sad but true.
Behind every strong, independent woman is her dog following her to the bathroom. And that is absolutely true what he does. He follows me. Does he follow you?
No.
That's very strange. Let's talk about dry eye syndrome.
Oh, yes.
And it's something that I discovered because I have dry eye syndrome. The fact that I went through menopause affected my dry eye and made it worse. But I guess you expect those kinds of things to happen.
Well, it's not unheard of. And of course, two main problems with the dry eyes are not making enough tears or the tears kind of evaporate. They have some issues with not staying around and evaporate quicker than they should. So it's a common issue. We should really be able to treat it, and I would recommend, again, seeing a specialist, an eye physician, and they should get you on the right path.
And I want to follow him up and say, go to your ophthalmologist because you don't want the ones that they sell in the drugstores. I don't know anything about them. They may be wonderful, but what I've read about for dry eye syndrome that you can buy over the counter is not going to do the kinds of things the doctor can prescribe for you. And they are prescriptions.
Right. Well, you need a diagnosis to exclude other illness. And there may be medications that are only by prescription that you would benefit from. So you're right.
I'm right?
You're always
Did you say
right.
I'm right?
You're always right.
Well, That's beside the point. I'll skip this one. Let's go to acne treatment.
Yes.
Getting from the older folk to mostly younger folk, but a lot of women when they're pregnant have an acne problem also. Okay, and I'm going to give this to you.
Oh, okay. Well, acne comes in different forms, and of course it's a blockage and excess oil production on the face leading to pimples, and some of them can be more superficial, some of them can be cystic and thick. When I look through high school yearbooks, we can see the kids who had acne, believe it or not, on their high school photos, and these individuals were really affected by it psychologically.
Oh, sure.
And so, and it could lead to scarring, of course. And the beauty of it, if you will, is that there is medication available, either be it topical or requiring medications. So again, I would seek out help because you have a condition which can be treated and should be treated.
Okay. And now we're going to move from there very quickly over to osteoporotic fractures. How do they compare with other diseases?
We'll get a load of this chart. Here we worry about heart attacks and we worry about strokes and breast cancer. And the incidence of those diseases pale in comparison to osteoporosis. Osteoporosis generally seen in females that are postmenopausal and have a petite stature. Can be seen in men as well. Cigarettes, alcohol, steroids, proton pump inhibitors, for example, can all lead to not only the thinning of the bone, but the bone loss. And so when you break a bone, it is life-changing, and especially if you fracture a hip, keep in mind that almost a third of people who have hip fractures within a year are no longer with us, and the other third...
Within a year?
Yeah, within a year. It's a life-changing issue, and it exacerbates what other illnesses you've already had, and you become more immobile, you lose your independence, you may end up in a nursing home, and only 1/3 really get back to where they were before. So trying to prevent the hip fracture is the basis of the treatment for osteoporosis, and of course the DEXA scan, which Medicare pays for every 2 years, will identify patients at risk for fracture, and good treatments are available for it besides just vitamin D.
They took care of my my wrist that I broke on the sidewalk.
Oh yeah, I remember that.
I remember that too.
And falls are very common. Get a load of this. 30 to 50% of people living at home will fall within a year, people over 65. And when you're over 80, this increases to 50%. It's quite a bit. And once you fall, bad things happen. And unfortunately, 50% of people who are in a nursing home will fall each year. That's quite a bit because of their debility, medications, the list goes on. And if you fall once, there's a 60% chance you're going to fall again, within that year. And so it's life-changing. So there are treatments for falling issues, if you will. You can go get some balance therapy or physical therapy at places like the Wellness Center. So really should take advantage of that before something bad happens.
I agree. Speaking of something bad happening, we've both experienced the loss of our parents and even the loss of siblings. And I didn't know if you'd like to speak to this at all.
Well, we are born, we're develop, and we die. And no one gets out of this world alive. And it's a question as to how you're going to land. Are you going to land like a plane, nice and smoothly, or are you going to crash and burn? So this brings up the topic that we don't really talk about a great deal, and that is end-of-life decisions. And hospice should be one of these things that you need to talk about as a family, rather than waiting till the 11th hour and have families having a tug of war of what mom or dad would have wanted. These discussions should be held now. But I'd like you to look at some of these things here about hospice services that you may not know about. Hospice is provided for patients that have terminal illnesses. And generally, if you are felt to have a disease that you're going to die within 6 months, that's someone who we would kind of look towards hospice services. Patients with both cancer and non-cancer illnesses, like dementia, for example, are candidates for hospice. Medicare pays for it, and there are great hospice services abound in our area. And the other thing about hospice is you get more help, because if you're at home, caregiver stress, the patient who's pre-terminal can bury the patient who's taking care of them. It's a 24/7, very overwhelming challenge. It really is. So,
Well, I know that I had hospice care for my mother, and thank goodness, because they were wonderful and took care of her and me, and then continued to call me afterwards to make sure I was okay. And we only have a minute left. So first of all, I want to wish a happy Mother's Day to all the mothers, mothers-in-law, stepmothers, grandmothers, acting as mother. Whatever your job is, congratulations on doing it. Thank you so much. And I have something to read to you. When we get to the end of our lives together, the house we had, the car we drove, the things we possessed won't matter. What will matter is that I had you and you had me.
oh, sweetheart, that's too kind.
You're welcome.
What can we say except the end? Thanks for watching It's Your
Yes.
Health. We're not going to be back after this brief commercial message. We're done for this show. So thanks for watching and allowing us to inform you and hopefully entertain you along the way.
Yes,
Thanks,
absolutely.
sweetheart.
Thank you, Sam.